5, but we also have some participants at our remote site, which is at La Luz Center in Sonoma, and then we have some online folks as well. So we've got a varying group of folks that are existent in participating in this learning communities. So the learning communities is brought by Strategies 2.0, and we're going to do a little brief introduction just in case you're not familiar with the organization in a little bit. So today we've got a really great dynamic guest speaker. And I am looking back and forth because there's a camera here and I want to make sure and provide eye contact to everybody. So Katie Aubrey is the Executive Director with Safe and Sound in San Francisco, and she is going to be talking with us about the power of numbers and the economic impact of child abuse, and a little bit more about the data in terms of how they were able to retrieve the data, but also about how we can leverage the data to create change and impact advocacy efforts. So really quickly, I just want to remind the folks in Sonoma, if you haven't signed in, please do. I will also be taking photographs during the event. If anybody's uncomfortable with me posting those photographs, feel free to let me know. Housekeeping, just in case, the restrooms are to the left, and you just turn left right after the doors. So I do want to mention that this Bay Area region, in particular for the learning communities, is in collaboration again with Strategies 2.0, as well as the Contra Costa County Child Abuse Prevention Council. I'm the new learning communities facilitator. This is my first convening, so I'm really excited to be here with you all today. And so a lot of what we're going to do today is really talk about, ground ourselves in what's happened in the history of the learning communities, but also explore what will happen in the next iteration as we're planning forward. So as I mentioned, we've got 3 groups of folks that are joining us today. I do want to bring your attention to the packet that is in front of you all. Online, you should have gotten all the documents emailed to you, and then in Sonoma, you should have a packet with you as well of handouts in about 10 minutes or so once our facilitator gets there. And then for our folks here in Alameda, the very last page is a participant evaluation. I just want to draw your attention to it. It's really important that we get everybody's feedback in terms of how your experience was. It's really valuable to us, and it makes us, it helps us plan forward. And it's anonymous, so please feel free to be candid. Yeah, well, we're actually going to do a quick roundabout in terms of introductions in a little bit. Yeah, thank you, Lana. So, really quickly, just in terms of logistics, I want to make sure that folks are aware of sort of what's going to happen, because we have these 3 sort of buckets of folks that are participating in this learning communities. The guest speaker will be here in person in Alameda. But what we'll be doing is actually taking pauses to make sure that we're creating space for the folks online, as well as in Sonoma, to participate as well. So you'll notice that Lana and I will be tag teaming and sort of cueing each other so that we make sure and create pauses and then ask questions for the folks that are online, as well as the folks that are at the remote site as well. And we also ask that whenever you do speak, you use the microphone, because that's the way that the folks online and remotely can hear us as well. So in terms of strategies, do we know if Michael is in Sonoma yet? Okay. Yeah. So we're going to have Judy Sherman come up really quickly and give us a little bit of background about Strategies 2.0.
Good morning, everybody. Good morning to you all. We're really happy that you're here. And I just want to spend a couple of minutes. I'm Judy Sherman. I'm a contractor with Strategies, and I work across the state with all of the Strategies learning communities to help make these happen. So I'm really happy to be here with Deborah and help her launch her first, and see Katie, who's a longtime colleague, and some of you as well, who I know we worked together before. So Strategies is a statewide nonprofit. It's a partnership of 3 organizations: the Children's Bureau in Southern California, the Child Abuse Prevention Center in Sacramento, and San Diego State University in San Diego. And as you can see on the screen, Strategy's mission is really to be a catalyst for professionalizing the field of family strengthening and family support. And you want to go to the next slide, please? Strategies provides free training across the state in many different areas, many different content, trauma-informed care, motivational interviewing, and many other things. And if you're interested in the trainings and you're interested in a particular training, you can contact Strategies through its website. There's also consulting provided by Strategies training and consulting specialists, as well as networking opportunities through the learning communities. Can you go to the next one, please? So this is how you can sign up for Strategies. There's a newsletter that's produced regularly, and you can request or register for trainings online, and you can see when the learning communities are coming up and happening. And of course, we always want to thank our funder, which is the California Department of Social Services Office of Child Abuse Prevention. Strategies is looking forward after this year, which will be its third year, to another 3 years of funding from the Office of Child Abuse Prevention, which has been a great partner as well as a supporter of our work over the years. I think it's back to Deborah.
Thank you, Judy. Or you can hold on to that.
Oh, this is
so I did want to create some space for Brenda to also give a brief introduction to CFRA, California Family Resource Association.
X right here. Good morning, everyone. I'm Brenda Diaz. I'm a project manager at the Child Abuse Prevention Center, but also for CFRA, which is the California Family Resource Association. And essentially, CFRA is a statewide membership association which gives voices to all the family resources across the state at the Capitol and through any kind of policy advocacy avenue that we provide. We do trainings on advocacy. We also have a monthly policy call where all of our members come in and hear what's going on in the Capitol or anything that's happening statewide. And I have a pamphlet on the other different benefits of being a member for CFRA, and I will pass that around. That's my quick introduction.
Yeah, I'll take that. So really quickly, just for folks who have not attended a learning community or just need a little bit of a refresher in terms of what our intent is with these convenings, we really wanted the learning communities to be a distinct experience for folks in terms of building some spaciousness for folks who are out in the field in the family strengthening work. Oftentimes we get really caught up in the day-to-day of our work, and it's so hard to take a pause and just breathe and be with each other. And we really wanted the learning communities to be a space where that can happen across the Bay Area, which gets a little tricky logistically, as you can tell. However, it's really, really vital for our sustainability, our self-care, and for our own capacity building to make sure that we have these spaces to continue to support each other and also get to know each other. It's important for, one hand to know what the other's doing all the time. And so, we want to be able to break these silos where folks are doing the work in separate areas of the Bay Area, and instead have a space like the learning communities to really bring folks together. So that's our larger intent. In the past year, what we really did was we built on advocacy efforts. Initially, we did essentially like a needs assessment to gauge what folks in the family strengthening field were interested in. And advocacy was at the top of the list, so we were intentional about bringing guest speakers on the topic of advocacy and what that looks like pragmatically in terms of supporting our children and families in the Bay Area region. Like I mentioned before, I will be taking photographs. If you feel free to take photographs as well, and let me know if anybody's uncomfortable with it, but these are some hashtags that you can use if you decide to post any of them. And also feel free to share with their networks this opportunity as well, because we really want to grow this community and be able to stay connected to one another as the experience goes on. So this is the agenda for today. So right now we're doing the welcome and introduction. Like I mentioned, I'm going to just briefly go over the past year. The Learning Communities is a relatively new project. So want to ground us in what's been happening in the Bay Area region. And, like I mentioned, it's a statewide initiative. So we're doing this all across the state of California in various regions, separated by geographic locations. And so, we really want to lift up what we're doing in the Bay Area. So I'll talk briefly about that, and then we'll have our amazing guest speaker take the floor for a couple hours, and she'll be embedding some space for Q&A in her presentation. And right after that, we will wrap up with some future planning for the next iteration of the Learning Communities, and then do some reflections and ask you to fill out your evaluations. So, you can just, yeah, thank you. So these are the objectives for today. So like I mentioned, we really wanted the Learning Communities to be a space where we can be with our colleagues, our folks, our people that, are doing this work with us in the day-to-day in the family strengthening field. We also, of course, want to lift up the work that Katie Albright has been doing in San Francisco, as well as the Bay Area and soon to be the state of California, in terms of raising awareness around the economic burden of child abuse and how to utilize that information on larger scales. We also want to be able to inspire creativity amongst the participants so that you can take something back to your own communities and your own organizations. So we want to be able to give you some tools that you can then provide to your own communities, and be able to raise the capacity of those that you work with as well. And of course, we want folks to participate in dialogue, and co-creation is really sort of the heart of what we want the Learning Communities to be. It's really important that whatever development the Learning Communities experiences is in co-creation and in collaboration with the communities itself. And that's why each of the regions tailors its work to the communities that they serve. Lana. So really quickly, just grounding us in the past year. So this is our 5th learning community on the topic of advocacy in particular. So it generally goes by fiscal year, but we're sort of spilling into this fiscal year. So the initial one that we did on the topic of advocacy was just to take a look at political trends in the family strengthening field and how to get involved. And then the second one was on the topic of immigration, which is a huge topic, that was in discussion amongst folks in the field in the past year, because it was just impacting a lot of the clients that we serve. And so we had a guest speaker talk about how it impacts the delivery of services. Next slide. And then we had somebody from the California Policy Center come and talk about the state's current budget. Just about the processes and how the processes and knowing about the budget can inform our advocacy efforts. And then after that, we had an overview of policy and advocacy from the Deeper Dive project, which is actually a collaborative project between FESP, SparkPoint, and Building Movement Project to take a look at how to integrate advocacy into service provision and direct service organizations. So we're just going to do a quick roundabout just to get acquainted with who's in the space here, as well as Sonoma and online. So I want folks to just really quickly go around and say your name and organization, what motivates you, and what are you hoping to walk away with after today's convening.
Hi everyone, again, I am Brenda Diaz. I am a project manager both for the Child Abuse Prevention Center and the California Family Resource Association. What motivates me is the collaboration that can get done with these kinds of meetings. I really enjoy that. And then what are you hoping to walk away with after? Well, I'm looking at the agenda for the PowerPoint and I'm just really excited to see numbers. I'm really into like numbers and data and how that really plays into the policy arena and changes. So I think that that's what I'm hoping to walk away with, using the data to see how we can make some change happen.
Hello, I'm Kylie. I'm the Director of Training for the San Francisco Family Support Network, and Safe and Sound is our fiscal sponsor, so happy to see Katie here today. And what motivates me in my work? I think children and families and how strong they are is my biggest motivation. But I also work with some really great people, so I think that collaboration piece is really present for me too. What am I hoping to walk away with? I think just more information and yeah, how to continue to utilize the economics report.
Great, thank you.
Hi, I'm Shelby Ferguson. I'm with Contra Costa Interfaith Housing. What motivates me in my work? I'm really passionate about individual and family homelessness. So I'm interested in that. And what I'm hoping to walk away with today is just looking at all the data. I'm a data person, so I like seeing numbers, and I think seeing how much things cost is really impactful. So I'm looking forward to diving more into that.
Great, thank you. So if folks online can go ahead and type in their introductions, we'll create a little space for that as well. Do we have the folks in Sonoma online?
Hello?
Yes, we can hear you.
Okay, so my name is Amanda and I work for La Luz Center in Sonoma. And for me, my title, I manage programs for our clients here in Sonoma, specifically adult clients. But one of the things that motivates me is the clients and the resiliency and their continued motivation to keep trying, keep building upon all the building blocks to come out on the other end. And one of the things for me, here at La Luz, I also do our data and our Salesforce and our reports and things like that. So for me, just to see how the data being collected creates impact is really interesting to me. So that's what I'm hoping to see other ways in which that's done.
Great, thank you.
We need to use our teacher voices.
I'm Chris Murphy. I work for the CANA Center, and we also work with the Greater Bay Area Child Abuse Prevention Councils. Of course, what motivates me in my work is, I guess, my own child and, the feeling that we're making a difference. And I'm excited to hear more about the facts and figures behind child abuse prevention that Katie's going to share with us.
Hi, I'm Debbie Rogers. I'm the Family Service Manager for Marin Head Start. And what motivates me is when staff can learn from families and families are learning from staff, and together they're growing and moving forward. One of the things that I'm hoping to walk away from is data, because data really drives the work that we're doing to serve families.
Hi, I'm Michael Williams with Strategies 2.0, and what motivates me in my work, I think over the long haul, it is that children are at the mercy of adult institutions and decisions, and so taking responsibility as an adult is kind of a part of it. And lately, it's being able to travel around the state and see great things that people are doing. What I'm hoping to walk away with after today's convening is ideas to share with other people in the state. And that's all of us in the room.
Great, thank you. The folks online? Do the folks online want to introduce themselves?
Ludi or Shanali, would you like to say hi? Oh, okay, that's no problem. It looks like they're not mic'd to do so, but they are online, and just feel free to chat us any responses that you have during the conversation.
Great. Thank you all so much. It's great to have such a diverse group in the space. So next slide. So I'm really excited to introduce Katie Aubrey. I've had the pleasure of working with her in various capacities at this point. She's doing some phenomenal, really groundbreaking work in the city of San Francisco and beyond. So Katie, I will give you the floor at this point.
Thank you so much. I think we're going to take just a couple seconds to set up.
I can just put it in my pocket.
Therese will tell us where you are in the camera.
Okay. And then at some point, I'm going to be using that. So I can move this over to here. Thank you. And I'll just say next. Are you doing it? Are you? Okay. Okay. Great. Thank you all so much. It's wonderful to be part of the Strategies 2.0 workshop. What motivates me is Kylie and Vanessa and all the people that I get to work with, Judy and Deborah and everyone who's in this field, because together we're really helping to strengthen families and end child abuse. And it's going to take all of us. And so it's really nice to know that we're in this broad community that really cares deeply about kids, cares deeply about parents and caregivers. So today what I wanted to do is be able to dive in, and it's great that people are interested in data. There's going to be some data I will definitely share with you. But this is a learning community, and we want to learn from you as much as you may want to learn a little bit from the work that we're doing at Safe and Sound. And so there's going to be opportunities throughout our session today that we can really explore some of this work, dive in deep. I will say for those online that I am not tech phobic, but I'm not a techie. And so thank you to Strategies 2.0 for sort of helping to navigate, but I do hope that the folks online are really participating, and so that we can try to bring these conversations together. So thank you so much. But let me just introduce myself and Safe and Sound a little bit more and frame our work. We're an organization that's been working in San Francisco for 45 years. We started with an amazing pediatrician who was working in our community for then Mayor Feinstein. And his name is Dr. Grossman. He recently passed away, unfortunately, but he was a pediatrician in our local public hospital, and he kept seeing the incidence of child abuse through the hospital, and he said, how as a community can we come together and protect children? And so he brought together what we believe was either the first or maybe the second or third Child Abuse Prevention Council in California. And now, as you know, every county in California has at least one council. The very first thing we did as our council, and every council does things differently, but what our council did in San Francisco was to create a 24/7 phone support line. And we did that because we know parenting is tough and it's 24/7, and we wanted to create a warm line for parents to be able to reach out for help. And from there, all of our programs have been created. Parents calling up and asking for respite childcare, or housing, or food bags, or counseling, or parenting education, sort of whatever parents needed. We were, like all of us in the Family Resource Center field, we were trying to create that place for families to come. We also are very much tied to our roots and really thinking about public policy and practice and how to move practice. And so through the work of the Child Abuse Prevention Council, continued to do, like many others do, mandated reporter training. We teach in our schools around safe and unsafe touching, and do a child safety awareness program, as well as a significant amount of education and leadership and capacity building for our network of family resource centers. San Francisco is really lucky to have 26 family resource centers, and we're all in different neighborhoods in the community, different populations working together. And I'm really lucky that Kylie is here because she is very much leading the network around how to support all the organizations, the family resource centers and other child serving organizations in San Francisco. And then the third piece of the work that we do, so we do our direct services in our family resource center, we do our community education work, and the third area of work that we do we call strategic partnerships. It's sort of a word that we use to really say we're doing systems change and policy change, and thinking about how to, again, partner with everyone in the community to protect kids. We run the county's Child Advocacy Center. There are many in different counties. Alameda has a fantastic one, the Calico Center. And we work with our local county government folks to help ensure that kids who have been physically or sexually abused have a safe place to share their story and sort of their first path of healing and justice as they move through the child welfare system. And this is where this work around our economics report really falls in, is as you can see from the sort of scope of our work, we do a lot of work with individual families, we do a lot of work with communities, and when you're working every day with families, as everyone here knows, we asked ourselves, it's not just about the families, and there's so much emphasis on what the negative impact is on families and how do we strengthen families, but how do we strengthen our community and what is the impact on our community as a whole? So we set out to do this report to really understand what that is. So if you could turn to the next slide. What I'll do is we've sort of broken this out into 3 sections. And so the first section, I'll talk about what is the economic impact of child abuse and some of the numbers, the data behind it, and what we found, particularly in the Bay Area. Then we're going to talk about, because once we know the problem, we're going to talk about strategies on how to solve the problem at a community level. And this is really where we would love a lot of feedback and your help on how do we build this community response. I'm so happy we're here with Judy Sherman because she has been so incredibly insightful about creating vehicles for change and beginning to lay out some of those strategies of how to move us forward. So I'm looking forward to that part of the conversation. We'll take some breaks, we'll have some feedback, we'll do some debrief, and then what we want to do is be able to take one, maybe we have an intimate group today, so maybe we do more than one strategy, and how do we use the economics report in conversation with people that need to move a strategy forward, and that'll make sense when we get to that part of the agenda. And then again, we have an opportunity for feedback throughout. For those on the phone, we're going to send you, and in our remote office, we're going to send you a link to help fill out the surveys and feedback forms. So we're looking forward to that. So what you'll leave here today with, because you're going to give us back a lot of information, but what you're going to leave here today is hopefully an understanding of the economics of child abuse and the burdens in San Francisco. Understand some strategies together on how to build protective factors in our community. And then we created the report, but we don't want it to sit on the shelf. So what are some real action plans about how to move it forward, how to leverage that report moving forward? And hopefully it fits into strategies overarching framework, and it ties into some of the work that strategies has been doing around advocacy and how to move advocacy forward. And like everyone else, we have many people to thank for this work. We started in San Francisco in 2017 with this report. We were supported by our local funders, and now it's grown to do work around the state, as Deborah said, and we are very, very pleased, particularly to be supported by the Office of Child Abuse Prevention and many folks the Cowell Foundation, who started the Family Resource Center movement, as well as others in the field who are incredibly helpful and insightful to our work. So many thanks to everybody. And then finally, we'll turn to the first section of the report. So those who are here, you have a handout of forms, so I wanted to make sure that you took a look at those. And as we walk through the day, I will be referring to the forms. And those who are online, they have been sent to you, and they've also been prepared for you if you're sitting with Michael. Okay. Terrific. So what I wanted to do is be able to just, for this section of the report, turn to a couple documents. One is this, what we call a one-pager, but it's really 2 pages, front and back. And it's entitled The Economics of Child Abuse, a study of the Bay Area and San Francisco. And then we also have an infographic that you'll see, which, to be honest, is much better to read online. And so we have that online, but we wanted to show that to you. We'll be walking through specifically the Bay Area in terms of our report. The other thing that you have in front of you is a packet of our slides today. Sometimes it's not the greatest thing to send out slides ahead of time, but we thought, because particularly that we're asking for feedback, that it would be helpful for you just to write some notes as you go through it. So I will turn now to my report. Let me just do one audio tech check to make sure everyone online is okay and there's no issues in our location. Okay, thanks so much. I appreciate it, everybody. So you may know that the Center for Disease Control did a report that came out in 2012 around what is the economic cost or economic burden to child abuse in our country. That report was based on 2008 numbers, pre-recession numbers. And what it found was that the economic burden to our country as a whole is $124 billion. And we began talking to people about that burden, and people kept asking us, well, what is it in San Francisco? And we were beginning to do this report in 2017. Those numbers that's a shocking number, and the number must be so much higher. What are the numbers locally? And so we set out to work with the Haas School of Business to determine what that number would be, because we wanted to localize it to San Francisco. We wanted to also bring it up to everyday inflationary standards. And we know the Bay Area and San Francisco at that point is just so expensive. So that cost must be so much higher. And so working with an incredible team at the Haas School of Business, we were able to create what we've called a cost calculator to be able to focus on a couple inputs that I'm going to come share with you today. And then what we've been able to do is take that calculator and adapt it to every county within the Bay Area to come up with an aggregated number. So the numbers I'm sharing with you today are based on what we did in San Francisco, but we've been able to do individualized reports for every county. So I know there are many counties here today. So we've done one on Sonoma and Contra Costa and Alameda, really all the 10 Bay Area counties that are part of the Greater Bay Area Association as part of this work. And Chris Murphy, who's on our phone remotely, has heard this presentation several times. Chris, bless you so much. Thank you for all your incredible work to lead the Greater Bay Area County forward. So, the headline here is that the overall burden, a very conservative number, and I'll explain how we got it. The overall burden, economic burden to the Bay Area is $2 billion for 1 year of victims in that single year. And so I'll break down how specifically we get there. If you turn to the next slide. So we followed the methodology of the Center for Disease Control report, and they looked at 5 different factors. I'll go over all the 5 factors. I'll sort of start at the big numbers, talk about how we calculated this, and then go down to the individual components of the report. And I know that these are really hard conversations. We're talking, as we all do, about child abuse. We're talking about child fatalities. I think sometimes we don't recognize how traumatizing it is to have these conversations, particularly when we talk about all children, but particularly I feel when we talk about child death. So please take care of yourself during this conversation and take a moment to breathe if you need to. But what we found, and we looked at 1 year, again, these are slices in time in terms of what we're looking at for the cost of abuse. In 2017, that's the most recent data, there were 5,775 substantiated cases in the Bay Area. That's looking at the data from the Berkeley School of the Child Indicators Project, which all counties give their information to the Indicators Project, and they then populate the substantiated numbers. They also have reported numbers, which we'll take a look at. And we know from the work that the Center for Disease Control did that a single case is in the Bay Area, based on our calculator, is over $300,000, $338,000. And so that gives a multiplier burden of $1.98 billion for the cost of substantiated cases of child abuse in the Bay Area. There were 11 fatalities in 2011, and the fatalities, again, I'll go into it in a few minutes, but the fatalities totaled $0.02 billion in terms of the cost, leading us to a total economic burden in the Bay Area of $2 billion. You can go to the next slide. But we know that, and those are, so that number, that $2 billion is based on substantiated cases. But we know that there are so many cases that we don't know about. So we went beyond that substantiated number and began to look at what would that number look like? What would the cost be if you just looked at reported cases? And so the reported cases in the Bay Area were 63,000 reported cases in the Bay Area. And then when you multiply that out, you get a total of $21 billion. Like, that's just a crazy number. It's so hard to get your head around it. We're gonna, in a little bit, give you some different comparisons of what that number is. But again, we know that there are so many more kids that are victims of abuse beyond that reported number. And so what we wanted to look at was what we're calling a prevalency number. How many kids in the community do we believe might be at risk for child abuse, are really at risk for child abuse, but have not been reported? And we did our research based on Professor Finkelhor's work out of the University of New Hampshire. I was just recently talking to Emily Putnam-Hornstein, who is at the Children's Data Network, to validate this number. We know, based on their research, that there's about an 11.5% prevalency rate. So that means that 11.5% of any community is probably a victim, children are probably a victim of child abuse. They may not be reported, but they are probably a victim of child abuse. And so we're calling it this estimated prevalency rate. And if you look at that number, it's $68 billion just to the Bay Area in terms of what is the cost of child abuse. So let me break those numbers down a little bit more. So that's a number. How did we get that number? There's both direct and indirect costs. And you can see, and I'm going to walk through each one of these. And what you're seeing here is that lifetime productivity is the most impactful number. But let me start a little bit more at the beginning. Let me start with healthcare. If you could turn the slide. So we know that victims of child abuse are more likely to struggle in school, more likely to have healthcare issues as children, and also as they grow older, more likely to enter in the juvenile justice system, more likely to be homeless, have difficulty finding jobs, et cetera, et cetera. And here's where the research and the numbers really prove that out. So victims as adults are 21%, have a 21% higher likelihood of healthcare costs. And we know it because our families, so many of our families that we're serving are coming to us with higher healthcare needs and costs, higher issues around substance use and suicidality, other kinds of healthcare, chronic healthcare problems. And we're seeing it borne out in the numbers. And again, if we could go to the next slide. And so these numbers are both healthcare costs in terms of the cost to the child, as well as when the child grows up for adults. And then we also know from research that children who are victims of abuse are 59% more likely to go into the juvenile justice system, and then later to go into the adult incarceration system, 28% more likely to go into that adult system. And the cost of that, and again, this is based on national research, the cost of that to the Bay Area as a whole is $44 million. We also know that there are some initial costs right when the child welfare system gets involved. And this cost is based on what the number is data that we found nationally. And it's $63 million, and it's cost for foster care and other intervention programs, other services, counseling services, et cetera. If you look at that individualized cost, it actually, if you take that down, these are multiplied, so it's multiplied by that 5,700 number. But if you looked at it on an individual level, it's about estimated, it's about 4,000. So we believe that that's actually quite low. And so we're working with the University of Chicago, Chapin Hall, to try to understand what really is that cost of child welfare in California. And so we're doing work in Sacramento and in San Francisco County. We're hoping to do work in other counties to begin to aggregate what that cost is to our state in terms of the child welfare number. But this is the best number that we have. Again, how we created this is we worked with we took this Center for Disease Control study, we looked at their underlying research, and then we took that research and we multiplied it by the number of kids we have in California. And I'll turn to education. Again, what we know from our work every day is that children who are victims of abuse are more likely to suffer in school. And we actually have data to show that that children who are victims of abuse are 77% more likely to need special education. So again, we looked at the underlying research and we calculated that the cost to our Bay Area, this is only to our Bay Area, is $74 million per year in a single year. And finally, and this is sort of a mind-boggling number. So those costs that I just went over are really what are the direct costs to the system borne by all of us as taxpayers in terms of what are we paying for education systems and incarceration systems and health systems. This number is more, loss of lifetime productivity is more of a number relating to what are we as a society losing when people aren't able to be able to achieve all of their economic status, all of their economic opportunity and self-sufficiency. And in the Bay Area, it's $1.4 billion. And we know that again, victims of child abuse are more likely to be unemployed, more likely to be homeless, more likely to struggle in their jobs. And so that's a substantial number. And finally, we looked at fatalities. Fatalities, this number is a combination of both what is those initial healthcare costs when a child is a victim of abuse that ends up in a fatality, as well as what is his or her long-term loss of productivity. So you can get those sadly from actuarial tables, and that's how that number is calculated. So let me put some perspective on what these numbers are, what that amount is, because frankly, $2 billion is too big a number for me to sort of think through what that number is. But in the Bay Area, what it means is that we could send 19,000 children to four-year colleges. We could send over 200,000, we could pay for over 200,000 years of preschool and have a substantial amount of roads paid for in our communities. We did this analysis again in San Francisco, and our numbers as a county are obviously just a piece of these larger numbers. But when we talked to elected officials about how much money we were spending on child abuse in a single year, and we said we could send more than 3,000 kids to four-year colleges for that same amount, it definitely got people's attention around how could we invest in prevention in a different way. So I wanted to just take a few moments for questions that people have and be able to really dig in deep. We just covered a lot of data, a lot of numbers. Happy to answer any questions on things and then be able to dive in, and I'd love to get some feedback about how this part of the presentation worked. So questions either online or right here.
We'll just take a little pause to give some space for the folks online to type in any questions that they might have, and the folks at the remote site.
Do we have any questions in Sonoma? Yeah, no questions in Sonoma.
Okay, thank you, Sonoma.
Okay, it must have been crystal clear.
I have a little question.
Yeah.
Just this concept of risk factors. I'm certain that there is a common definition of risk factors that are applied to these calculations so that when we talk about those, we know, everybody knows that they're talking about the same things. I think one of my interests in the field is to make sure that when we say this, we all say, yes, that's what we mean. And so if there's a, I don't know if you have time to speak to it, but if there's a resource that people could go to say, okay, so these are the risk factors that are making up this data.
Thank you. And we're going to spend a little bit of time on that. And I think it's such an important question. So our data is really based on what the Center for Disease Control came up with. And as we all know, there are risk factors. And Judy, I think this is where your question is. And if I don't answer it, definitely jump in. And also, I'm sure, love to get your thoughts on this. Obviously, there are risk factors at the individual child level. Just a child being under the age of 1, under the age of 5 is a risk factor for abuse. There are risk factors at the family level. Having a history of violence, being in a domestic violence situation is a risk factor for abuse. Judy, I think where your question was going is, what are the risk factors as a community, as a whole? And so one of the things that we looked at in San Francisco is particularly, and I want to spend some time at the next our discussion, is what are the risk factors that we as a community are creating? Because we have maybe a tendency of saying that that it's the family that needs to solve these problems. It's the family that needs to be strong. It's the family that needs to find housing. But what are we as a community doing to create risk factors? And what are we doing as a community to mitigate those risk factors? So the CDC, and I think its list is incomplete, to be honest, and love to spend some time today talking about it. But the CDC looked at social and socioeconomic inequality. So not just are there families living at a poverty level, but is there an inequity in poverty, which we're absolutely seeing in the Bay Area and absolutely seeing in San Francisco. Also looking at residential instability. And we are absolutely, as I was driving here, absolutely seeing the impacts of lack of housing and families that are homeless and living in unstable situations. High emigration and immigration. So both families moving around the Bay Area, moving to different communities, losing their community in that sort of social connected hub is a potential risk factor. Having emigrated or immigrated into America is both a protective factor, is research is saying, as well as a risk factor, particularly when we're thinking about changes in immigration laws and enforcement. Community violence is a risk factor. San Francisco, when we looked at this number, has one of the highest rates of community violence, and then you have the disproportionality of community violence in certain neighborhoods, and that's a risk factor. High rates of unemployment, and what I found interesting that the CDC focused on was also high rates of alcohol outlet density. And San Francisco has a lot of liquor stores. We're looking at California as a whole in terms of its density of liquor stores. And frankly, that is a hard thing to think about, alcohol outlets, because it's also somebody's livelihood. And so how do you balance that? I found it interesting that the CDC, things that are not on this list, The CDC list does not include gun safety. And there are other components that we can brainstorm about what else is not on the list. And Judy, I don't know if that's sort of where you were going with that question and that's what you were thinking. I'd love to hear more in terms of your expertise.
Well, I don't know if it's my expertise, it's just my curiosity really. But I think while you were talking, I found a CDC link for the risk and protective factors from their perspective. And as you were talking, I was thinking, are these the social determinants of health really? And that's kind of the,
We do have 2 questions from online.
Okay.
The first is there data on generational effect of child abuse, such as abused children growing up to abuse their children?
Thank you. My understanding, data that we've looked at, says that families who are in who have had a history of abuse are 35% more likely to be potentially in another family the next generation. Not to say that if your child is abused, you're going to then be an abuser, but that you're 35% more likely to be in a family that has violence in it. And I'm happy to send out that data point for folks.
And the other is there a breakdown of data available for other counties? That would be helpful to take back to our organizations.
Yes, I would love to know which county you were in, because let me go back to the first question a little bit, because I don't think I fully answered that. One of the there are several limitations of this report, and that was because we had this underlying data and research that we were looking at. And one of the limitations is actually, how do you quantify what the cost is, not just to the individual child. Our research is just focused on the individual child. It's not focused on what is the cost associated with the caregivers in that family, what is the cost associated with the siblings in that family. And we know that siblings have a deep amount of impact that they may have by being in the same household as the victim of abuse. And certainly a caregiver, particularly protective or otherwise caregiver, there are a lot of costs associated. So that is a limitation of it. So to that question around what is the generational, what are the generational data points, that is, again, a limitation of the report and something that we may think about looking into in the future. To this question, now I've just forgotten it. Can you repeat it?
Yes, the question is, are we able to get a breakdown for each county? Is it available? It would be helpful to take back to our organization.
Thank you so much. So we have done an analysis of every Bay Area county, and we are very happy to provide that information. And we are also in the process of doing a report for the state of California that we are anticipating releasing at the beginning of next year, in 2019. And then we are working on a cost calculator that we are hoping will be publicly available for people to get this information if they are outside of their jurisdiction. That said, because we are all one big happy family and we are in this intimate environment, that if we haven't done your report, my guess is that Vanessa and her colleagues will be able to quickly do a report for you if that's something of interest to you. So if you can just let me know your county, we can work out whether or not that is something that you could use. What I'm really interested in terms, and we'll get to this in a few minutes, is how you would use this report. And so we'll spend some time later on in our session because I love the question, but I want to know how you're going to use it so we can make the tools more valuable to you. There's no more questions. This is my opportunity asking you guys for help. If you could just give us feedback, and we have, for those that are here, a feedback form, and for those that are online, we'll send you a link. If you could just fill out in this very first section, it's called the economic impact of child abuse to the Bay Area. If you could just fill out any feedback you have about what you learned, was it helpful, was it not helpful, it would be incredibly important for us. So I'll give you a few minutes to be able to do that. We'll give this just about 2 more minutes, and we'll come back for the second section. Thank you so much. We'll come back and we'll do the second section of the presentation. And again, I would love to be able to prepare this. This section is much more interactive. I'd love to be able to share some information about our work and where we're thinking, but what I really would love to do is be able to have a conversation about how we can begin to identify what are community strategies, community-wide strategies to be able to prevent child abuse beyond and incorporating all that we're already doing right now. So for those on the line and for those here, we're going to be referring to this document called the 9 Strategies to Build Community Protective Factors, as well as, again, we'll come back to that feedback form during the presentation, but just so you have that handy with you. So the way we think about our work, if you could turn to the next slide, the way we think about our work, and I know many of you, is really a ecological model. We start with what our outcome is. We want to create and have safe and happy children ultimately, but we know in order to have safe and happy children, we need to really think about this 2-generation approach, and it's about families and how do you ensure that families, parents, caregivers, everyone in a child's life is also protective, and how do you build those protective factors around an entire family. But in order to protect a family, you need a community, and you need a community that is strong and healthy and takes action to protect kids. And when you think also about that community, you need a government system that is both public-private, interactive. It's so wonderful to be here at First 5, because First 5 is that amazing government partner that comes together and helps kids and families. And then we also need not just the system itself working, but we need a society that is working to help and protect children. We need to change hearts and minds. We need to change norms, attitudes, and beliefs so that one day we will all wake up at some magical moment and know that it is just unacceptable to hurt a child, and it is unacceptable to not support a family. And so that's sort of what our overall mission is how to think about how to create that society where everyone is safe. And so if we go to the next slide, going to really what Judy is really moving our conversation towards is not only what are the protective factors for families, but what are the protective factors for community. And I want to make sure that that folks on the line can see this document in a second. But while we're waiting for that camera change, We all know that there are 5 protective factors for families. I don't think I need to go over that. I'll check in with my colleagues, Shelby and Brenda. I know Kylie teaches on this, so, but we all know what the 5 protective factors are in terms of supporting families. And folks on the line can see the board close enough. Okay, I'll read them. But what we've been trying to do is really, Judy, and here's where I'd love some interaction. What we've been trying to do is not just identify what the protective factors are in a community, and I'll get to it, but what are the risk factors in communities? And so I've outlined the risk factors that I talked about previously. So social and emotional inequality, poverty, immigration, emigration, community violence, unemployment, density of alcohol outlets. But what else do you believe are risk factors in communities for child abuse? And love help from Sonoma and other folks on the line.
So here in Sonoma, we were just figuring out how to type into the online form, and we did not hear that last question.
Oh, he didn't hear the question. Okay, thanks, Michael. Yes, the question is, the research shows, and there's been some information that I've been able to glean, but not all of the information. And that's what I'd love us as a community, a learning community, to work together to help think about this. I want to go over 2 questions. One, what are the risk factors as a community level for child abuse? And what are the protective factors at a community level for child abuse? And so some of the risk factors that the Center for Disease Control has identified is social and emotional inequality, economic inequality, poverty, emigration, people moving out of a community, immigration, people moving from other communities, community violence, unemployment, as well as a high density of alcohol outlets. And for those on the line, my handwriting is not that good. Hopefully you can read it. And I can say that again. So the question is, what other risk factors do we know to believe, based on all of our work, are at a community level, what are risk factors for children and their safety? And Kylie, you were about to say something, and then we'll turn it back over to Sonoma.
So just kind of extending upon the socioeconomic inequality about alcohol outlets, I think there's also this idea of food deserts, right? Lack of accessibility to concrete resources. And then the other piece there that I'm thinking about as a risk factor are both the quality of services and the accessibility of services around the community.
Can you talk a little bit more about that last piece?
Sure. I think in some communities where there is this high density of alcohol outlets, there isn't a lot of good quality food. The other piece that I'm thinking about is how these families are supported, and if support services are not in the community, around the community, or strong in the community, I think that is definitely a risk factor. So, are there after school programs for children, or are they just walking home after school and doing whatever they want to do? How are families able to create and sustain social connections with the people around them? Are there community centers that have this place to really network and connect in that way? Yeah.
Great, thank you.
I think just to
Brenda?
add to that, I was thinking about the quality of education and whether the teachers who are in that community really connect to the kinds of families that are in that community. I mean, if you have all speaking students and the teacher doesn't know how to speak to the parents, how do you make that connection with the parents and the children? So I think that just goes into that.
Thank you. Michael, hopefully you heard that in Sonoma. I don't know if you have other ideas about risk factors.
It's a little piece of it, but I'm not sure if someone said this, but I know that the population that we work for are fearful of getting services from agencies that might get state funded or federally funded because of immigration status. So they tend to isolate themselves and not access the resources.
And can you let us know if you're on the phone where you're calling from?
So I'm Marin County Head Start program.
Thank you.
Anything else in Sonoma?
I think for us, one of the really great things here in Sonoma, this is Amanda, I work at La Luz, is that here at La Luz, all of our service providers that are working with clients are both bilingual and bicultural, so that the clients and the families, they know that they can talk to us in their language they feel most comfortable, or for some, the only language that they understand. I think that's one thing that's really helpful and really helps the clients feel comfortable and trusting La Luz.
Thank you so much. And I put that under risk factors as need for bilingual services.
Yeah.
Okay, we have a comment from Shanali. This comment is, risk factors could include abusive behavior being a norm due to generational abuse.
That's so interesting. If that online person could write more about that, I'd love to know. But it sounds like basically abusive behavior becoming a norm because of generational violence. And while others are thinking there may not be others, but add also gun safety here and gun violence. So I'll move on, but as we percolate this, if there are more ideas that come around risk factors, let's please add them. So I want to move to a more positive place and talk about not just risk factors, but what are protective factors in a community that we can think about in terms of how to build strengths in our community. And so a couple that are in the literature in terms of community risk factors are building economic supports, changing social norms. We talked about that a little bit on this last question. How do you change hearts and minds? Creating stable housing, access to healthcare. There's probably more. We talked about education, but I'd love to sort of fill out the list together. And parks and places for families. So if we can think about, that's just a small list. If we can just generate some other ideas about what are some community protective factors so we can create some shared understanding, then what I'd like to do is then go into strategies and how are we going to create these protective factors in our own community, whether or not it's Marin or Sonoma or in San Francisco or Alameda. So what are some other protective factors that we can think about? I'm going to put our colleague from La Luz on here when she talked about the need for bilingual services, that would be a protective factor.
So protective factors in Sonoma, Marin?
So I'm going to speak on Michael a little bit, providing early childhood education, so child development knowledge for parents, connecting families to a social network within, for instance, we do home visiting, so we do socializations where parents come together with their children, so they're building natural resources with one another.
Thank you.
When you say that at the micro level, but at the macro level, when a community is invested in early childhood education, then the community itself has that protective factor as well.
Thank you. I love that. I just put it in as invested in early childhood education.
Oh, just a comment from online that yes, that the summary that you gave was what she meant, that generational violence being passed on to children.
Thank you.
Another thing in thinking about like leadership opportunities with families so that they have a voice that's being heard, acknowledged, and valued. So it's building that sense of accomplishment and self-worth.
And I'm curious who, it sounds like somebody in Sonoma. I hear Michael in the background, I think. If there's things that you have done around how to build that parent voice, parent leadership, and maybe you could elaborate on that.
So in Marin County, there's a program through our, it's called the Marin Child Care Council. And so families from our program sign up to be part of something called Parent Voices. And that's a way for parents to learn how to lobby about issues in their community, and they get trained, and they go to Sacramento, and they march and talk about their issues. We've had some parents from there go to Washington, D.C. to speak. So that's one way. Another way is just a more simplified way is having parents be room parents in our program. So they're supporting teachers and doing learning activities with children in the classrooms. We have a policy council where parents are coming and helping us determine what our policies are going to be. And we have a health and nutrition advisory committee that they're part of. So opportunities like that have really helped to strengthen our program and strengthen their community.
Terrific. Thank you for sharing. And what I heard was Parent Voices and Marin Child Care Council as some of those opportunities. And so we'll make sure we record that.
I was going to say the exact same thing to get the community involved in the policies, but you could also add to get the teenagers involved as well. I mean, I think it's not just the parents. If you get them to be at a younger age and you get the perspective that's a little different than just parents. So that would be my little add-on.
Have you, are you aware of good programs or efforts to bring teenagers?
I don't recall the exact name, but there was a specific program that I remember where they would go to the schools and bring the students to their local legislator, and then they created a bill where they wanted to make sure that nobody smoked a certain amount of yards from public parks or anything that's recreational for students or for kids. And I thought that was just fantastic because they were little kids. I mean, they were like 10 years old, getting involved in policies and how that can really change. It's fantastic.
And they were probably so heard by policymakers because they were a different voice. Yeah.
It's really cute.
That's great. Was that in, remind me where you're from?
I live here in the Bay Area, but I do work in the Child Abuse Prevention Center.
Okay, great.
I would actually piggyback on that and lift up when true collaboration with communities happens. It's pretty remarkable when you're thinking about service for community by community, where you're not just engaging them in this actual delivery of services or in supporting their advocacy efforts, but also engaging them from soup to nuts in terms of the creation of the service provision. I think can be really, really protective and build and deepen relationships between an organization and the community, especially if an organization comes in and brings their services to a community where perhaps there are no previous ties. It's a method that I've seen successful for, say, family resource centers or other organizations to talk and be with community first before coming in to provide services, and making sure that the services reflect what the actual needs are, because they're constantly evolving. And if you're staying attuned to what those needs are in that moment, then you can actually tailor the services to be responsive to those needs.
Great, thank you.
So I just want to add check, because this idea of involving people in policy change that actually reduces the barriers that exist for families to thrive is a critical component of strengthening families, strengthening communities, and of course, reducing child abuse and neglect along the way. And I think, not to belabor the point, but I think we need to belabor the point because I think this is really important to lift up is when we change how we perceive the people who we work with from people who have needs to people who have something to contribute, then the action that we take is different.
Okay, so protective factors could include educators educating on abuse and building a trust with children who need to speak about their experience. Also, peer-to-peer support.
What was the last part? Peer-to-peer support?
Could include training children, teens to help their friends who are experiencing abuse through counseling, encouraging to report or reporting themselves.
Great. So I'm going to call that educators teaching children and mandated reporting. Great, thank you. Oh, yes.
I have one more comment.
Absolutely.
Just one more thing I thought about because I live in San Paulo, and what I really like about San Paulo is that they have a lot of community events, whether it's like Cinco de Mayo or the 4th of July fireworks, or they're not huge events, but they're small events where a lot of the community members come out and they get to meet their local police station and they get to meet all the local businesses around, and it just makes it feel like you're part of something bigger than just your house in that city. That could really play a big part on being part of the policy changes and just, feeling more valued as well.
That's terrific. Okay, we're not going to leave this conversation, but I'm just going to move us forward a little bit to talk about, if you could turn to the next slide, to talk about really strategies that we can all adopt on a sort of a more concrete level to both mitigate those risk factors we talked about and how do we build protective factors in our community. And we talked about a couple of them. One of the things we're trying to do at Safe and Sound is build out this list. It's actually one of the things we're trying to do at the Greater Bay Area Child Abuse Prevention Council is really thinking about what could a policy platform look like moving forward. Chris, if I could say that, if I could share that. And so we've been brainstorming, and I want to continue our brainstorming. This is really how to, again, continue the conversation around what are some strategies. These are 9 strategies that we pulled together. We did work with the Haas School of Business over the summer and last semester to look at look at the evidence base for changing social norms and mitigating those risk factors and building those protective factors. So these are only 9 evidence-based approaches. They're on this document. Oh, sorry, the right document. Yes, they're on this document. When we developed it, we thought about who are the people in the community that we could have that are part of the solution that we need to bring into the solution. And so if you look at the circle, we talked about how do you hug that family? How do you provide that family with the supports that they need, whether it be from the faith community or your local neighborhood community, those community events? How do you become part, Brenda, of that community? We talked about education and childcare. We talked about doctors, which is something that we have not yet talked about. What is the role of healthcare community? And so that was sort of that inner circle that families may be already immediately associated with in their everyday world. But then we talked about a larger community than that, which is what is the role of media? What is the role of business? That the briefcase is supposed to represent business. What is the role of business? And what is the role of our elected officials? at the government. And so that's sort of the framework we looked at. Who are the people that can help us build community protective factors? And then we began just brainstorming a bunch of ideas. And those ideas, we call them strategies. We brainstormed a bunch of ideas. We distilled it down to these 9. We distilled it to these 9 only because these have some evidence behind them as proven strategies in other communities that work. But what I'd like to do now for just a few minutes is continue to brainstorm what are some other strategies. You could actually keep it on that slide. I think it might be helpful, but thank you. What are some other strategies that we can use to help build protective factors? So let me just review what we have to get everyone on the same page, and then we can build. So again, I'm looking at this. I'm going to go in order of this document, these 9 strategies. So pediatric partnerships, and there was a lot of words on the page, so we took out sort of the middle example. But an example of pediatric partnership is a program called SEEK. You may know it. It started in on the East Coast, I think in New Hampshire. But it really creates, and we probably see it so much in California because we have the our Kaiser partners that are such amazing ambassadors for prevention. But that kind of pediatric partnership, what is the role of doctors that we could use? And somebody talked earlier about the importance of mandated reporting. And I know Office of Child Abuse Prevention, OCAP, is doing with strategies a great deal of work around how to take that online platform, online mandated reporter platform, and move it to the next 21st century, so to speak. And in addition, I know communities, certainly in San Francisco, but many others, do a lot of work around mandated reporting training. But what else can we do in order to continue to improve the mandated reporting system? Parent education. I know many in the community do triple P. There may be other evidence-based or non-evidence-based programs we do. What else can we do to move parenting education forward? How do we think about community-based family and youth activities? We spoke a little bit about getting that youth voice out there. What else? Family resource centers. This is something that I know many here are in love with. I'm definitely a huge proponent of family resource centers. Thank you, Judy, for moving this field forward. But what can we do to even instill the field even more? These next pieces are maybe may not have thought about before, but how can we think about positive parenting and our values with the faith and the spiritual community and really partner with faith-based leaders? How do we think about family-friendly practices in our business, whether or not it's increasing family leave or living wage, or you can sort of, the list goes on about what those workforce policies could be. Public awareness campaigns. Certainly California and the Bay Area has done a lot of work around the Enough Abuse campaign in terms of ending child sexual violence. What else can we do in terms of moving campaigns? And do campaigns work, or what would it take to make them work? And finally, promoting positive parenting in public spaces. So creating parks, creating events, community events where parents can come out. What else does that look like? So I'll pause here and answer any questions about these 9 strategies, and again, why we picked them and what they are and what they mean. But mostly what I wanted to do is be able to open up this conversation and see if there are any other strategies that we can add to this list. And then what we'll do is we'll take a little bit of a break. We'll come back. We'll pick 1 or 2 strategies, and we'll understand in that strategy how to move that forward, and how are we going to use the economic report to move that particular strategy forward? What are we going to say about the numbers to move that strategy forward? So that's the rest of our session today. So let's just take a few minutes just to brainstorm other strategies that we might use to really get at the protective factors. And this may be a complete list, I doubt it. So while people are thinking about it, I will just start off on a couple of them. When we think about One of the risk factors is around community violence. Should we be thinking about gang intervention programs? When we think about a risk factor around age of the parent, teen parents, should we be thinking about programs to support teen parents? So those are just two ideas. So Kylie has the microphone.
High quality early childhood education programs. And I think that high quality ECE can really touch on some of these other strategies, but very specifically having that, I think, is key.
Thank you.
I think you touched on the parental leave. And I don't know if that would be more of a businesses or elected government or a mixture of both. That would have to figure out how we would work that in. But another thought I had was on transportation and just getting that transportation within communities, and some may have great transportation and others don't, and some who do are just too expensive. It's just that having that transportation for families to be able to really get to their jobs and back and forth.
Thank you. I know living in San Francisco, I always forget about transportation. Thank you for sharing.
Anything from the folks in Sonoma or online?
Those protective factors.
We're pondering. Yeah, it's kind of you had it covered, but more like what the examples would be. Yeah.
I would add non-traditional spaces when thinking about supporting kids and families. And what I mean by that is on a day-to-day, our kids and families in the community there are multiple touch points that, they're experiencing, right? In their day-to-day, they're running errands at the bank, they're going to the grocery store, they're going to hair or nail salon. All these spaces are spaces that community members could be more aware of in terms of how to intervene or how to support, a fellow community member. And so I think there's an opportunity for probably deeper community relationship building as well as capacity building in these spaces, because it's important to not forget about what happens on a day-to-day versus what happens every now and then. Every now and then you go to the doctor. Every now and then you might, go to the library, etc. But, forgetting about the day-to-day spaces, and you're taking out a huge, huge part of the daily experience. So I think that's something to consider as a strategy.
The grocery store, the laundromat.
Right, exactly. Okay. All of the above.
I think I would add to that and thinking about adding community organizing, which that is, but community organizing with different kinds of intentionality. So one is on, bringing people together, community organizing. Another is for speaking power, legislative policy, decision makers. And then you already have on here public engagement information campaigns. That's an advocacy activity that kind of requires community organizing, I think.
Great. Just a few seconds more for folks on the line or in Sonoma. Oh, Brenda, yes.
This is a very broad and big idea, but
we like those.
Increasing local community businesses, making sure that the owners of those local businesses are actually community members, not just outsiders who are coming in, because that really does make the difference and in where the money is kind of running through. Like, is it just staying in the community, or is it being pulled out to other communities?
Nice. maybe some incentives to have local business people start their own business, stay there.
Exactly.
Okay, so this is the end of this section, and we'll see if there's any other folks online who want to share anything. But what I wanted to do is be able to open it up again. Okay, we have one question.
All right, so piggybacking on the public education, but teaching people on the signs of child abuse. A lot of people don't even know what to look for.
Thank you. And I just might add, teaching people the signs of child abuse and maybe how to help and intervene. Like, what do you do when you're in the grocery store and you see a family in a really hard situation? How do you help? Great. Okay, so sort of at the conclusion of this second session, what I'd love to do is be able to, again, get your feedback on this. For those that are here, fill out the second section form, strategies to create protective factors, and those online, you'll have a link that you can fill that out. And then we're going to take a break for about 5 minutes, stretch our legs, and we'll come back and we'll go into the third section where we're really trying to bring these two together. How do we bring the economics piece of the work and the data? How do we bring these policy strategies forward? And how do we move an initiative forward? So that will be our final section. Thank you. Hi, everyone. We're going to come back online. So grab your last drinks of water or your other food. Hopefully you have yummy food up in Sonoma. And we'll start. If we could turn to the next slide. Great. So as I said, we're dividing our work into 3 sections. So the first section, we really talked about what are the economics of abuse in the Bay Area, and you have handouts around what is the cost in the Bay Area, and we've already done reports around what is the cost in each one of our counties. We then had a section to really focus on what are the community risk factors, what are the community protective factors that we as sort of et al. Are living in. We generated an amazing amount of content in order to fill in around what are risk factors, what are protective factors. We also generated a lot of strategies, really on sort of every single sector, or we began to touch on every single sector, from the public at large to education, to our pediatricians, to and healthcare community, to our community at large, to talking about how to raise up voices. And now we're going to go into a section to really sort of bring those together again, and how do we use the data that we know around the cost report and begin to advocate some of these strategies. But before we do, I wanted to just open it up to see, I know Judy has a comment about the last section, and I just wanted to be able to open it up to see if anyone has any other comments or thoughts before we move into our last section.
Thanks, Katie. As I was looking at the 9 strategies document, I started drawing lines to 2 things. One is about identifying who the people are on this list who are investors or potential investors in our work. And the other is which organizations work from a social justice perspective. And thinking about child abuse and neglect as a social justice issue, especially when we start talking about policy and we start talking about constituent and resident engagement and lifting up people's voices. Those are all, and advocacy, those are all social justice issues. So an example of identifying investors is every time I see partnerships with pediatricians or the medical profession, I think about if we, all of us, are putting information in their offices or educating people, doctors and medical professionals, about the impact of child abuse and neglect, not only on the individual children and families, but on our society, on our community, and inviting them to refer people to us. How do they become investors and not just sources of referrals? And I think anytime we look at a sector as a place where we connect with, we want to think of them as a both an investor and also as a partner or a participant.
Any other comments or thoughts? Yes, Brenda.
I'll add to your comment regarding the investors. I think if we have local members be the business owners, that could really also be a good connection.
Thank you. We are absolutely collecting all these feedback and notes, and we will spend some time writing up all this information so that we can share it out for others. And so thank you so much. It really is very rich. Wanted to move on to this next section, but tell you why the feedback is so important to us. We are working on a community action tool to how to have these kind of conversations in communities. And it's so what we're looking at today is part of a larger toolkit that we were able to work with the Haas School of Business on. And it needs a lot of love and attention to move it forward. And so that's where you all come in, really helping to provide feedback on what works, what hasn't worked as we move this work forward. So really the feedback, and we'll have another feedback section at the end, the feedback is critical, and you can be critical in your feedback. We are very happy to have some honest constructive criticism as we speak in terms of how to move this work forward and how to improve it. We always know we can improve. So this next section, there are two handouts that I really want everyone to make sure that they have. One is a document called a partnership landscape, and we're going to fill this out together in groups and individually and do some feedback and sharing. I'm going to walk you through how to fill out this document and what to think about. And the other is I want to make sure that that you have the copies of the notes of the PowerPoint. And we can, for those who are remote, we can go back to slides if that's helpful for you, so that you can refer to things if maybe that you need to forget. And you also have, obviously, your cost breakdown in the Bay Area. So before we, so this is sort of the hands-on, let's really figure out how to be practical, let's really figure out how to use this information. And so if we could go to the next slide, what we're going to do is begin to think about taking action. But this is really a part around how to take action and use these messages going forward. And so we're going to look at 6 different components. And I think what's going to be helpful as we walk through it is if you can think of 1, 2, maybe 3 strategies. Let's just try 2 right now that you want to walk forward. So by that, I mean, let's say you want to focus on transportation, how to improve transportation access in the community. Think about that and what is the message that you're going to use going forward. So pick whichever one you want to walk forward. We're going to share that, and we're going to share what you would say to somebody in that context. So let's, as a first step, we're going to talk about who's at the table, who do you want to have this conversation with, what's their role, What's your current relationship with them? And what do you say? And are there any good comparisons to support this? So let me take each one of those steps one by one to have you think about it. But I think it's really important, at least for me, how I would do this exercise is have your idea in mind. So I'm going to just walk us through what I would think about transportation. So why don't we go to the next slide? So who's at the table? We talked a lot about building collaboration, building coalitions. We want a lot of people at the table, big tent, if we're going to move these issues forward. We also want to figure out who are the right people because we have limited resources, right? So who are the people that can really move this issue forward? So I think about policymakers, funders, city and county partners. San Francisco is a city and county. Each one of us is in a county. So who are the right lever points in your county? Community partners, maybe they're faith-based leaders. There may be other folks in your community that are those key players. So let me take transportation and let me just focus on San Francisco. The people I would focus on to improve San Francisco transportation is our Board of Supervisors. And I would also focus on our bikers. San Francisco has a lot of bikers, and so if you want to do anything in San Francisco around transportation, you need to involve the bike coalition. And I also might think about involving philanthropy and business, because those are essential partners to think about how do you move it forward if we need to build the infrastructure, for example, in San Francisco, or if we're going to impact a neighborhood. So those would be my who's at the table, some of the things I would think about. And if we go to the next, I would say, so what is their role? So let me take the Board of Supervisors. So their role is to ensure that there's legislation and budget to change any transportation policies we need. Maybe we need to put in a tax in order to raise money for improved bus systems. And so it's going to be critical that we get the Board of Supervisors on board because maybe they need to pass a charter amendment. It's also going to be critical, let me go to that bike coalition. Because if we're going to improve our bus transportation, it's going to take bike lanes out, and it's going to be critical to sit them down at the table and explain why it's so important that we improve bus transportation, because families with young children need to be able to ride their bus. They need to be able to ride it safely. They need to be able to make sure that they can get their strollers on and off the bus safely. And at the same time, we need those bike racks out front. So I am just completely brainstorming because I told you at the beginning I didn't even think about transportation. So you may have lots of other things that you would think about for transportation, but this is how I would just begin to think about it. And I would think about what their role is. So the Board of Supervisors is about money and policymakers. The Bike Coalition, maybe it's their expertise because they are very good at transportation. But maybe I also want to bring in community voice, and maybe I want the transportation to go to one particular neighborhood. And so it's going to be essential for me to get a convener there. Who is that sort of that community hub person that can bring everyone together to think about that? So then we'll go to the next slide. So again, keep your idea in mind about what issue you're moving forward. Then I want to think about what, as your organization, you sitting where you are, what is your current relationship to that person? So at Safe and Sound, we have a really good relationship with our Board of Supervisors. So we would be able to go into the City Hall and talk to our mayor and talk to our Board of Supervisors about why this is so important. But we don't have any relationship to the Bike Coalition that I know of. We may. And so I would talk to my colleagues to see if they had a relationship with the Bike Coalition. But then I'd have to figure out how to bring them along. And I'd have to think about what are their values? Do they understand about kids and families? Do they understand about child abuse? Just how would I create a conversation with them that was meaningful for them? Because maybe they were very interested in environmental issues because they wanted to have low emissions. Maybe that's what the Bike Coalition is all about. And so how do we have a joint conversation where I say, I totally agree with lowering emission standards. That's good for the environment. That's good for kids. And how are we going to get how are we going to get more buses to neighborhoods? There may be also historical considerations to think about. Maybe the child coalition went up against the Bike Coalition to get funding. And maybe we had some kind of a riff at some point. Maybe, politics is super local. maybe we were just neighbors and we didn't like each other. Or maybe we actually maybe we are parents and go to the same school together. So those kinds of components are really important to think about around how you're building a coalition. So let's go to the next slide. So this is how I want to begin talking about the economics report. What are we going to say to persuade our partner and persuade them to move forward? And how are we going to tailor a message that is most meaningful to them? And then how are we going to use the economics report in terms of tailoring that message? So for the transportation, maybe what I would say is, the cost of child abuse is so deeply significant in our community. And if we were able to divert resources that we are spending on child abuse and prevention of child abuse and the costs of child abuse, and we were actually able to repair our roads, we could get better, lower car emissions. I'm struggling here, but right, we could improve our transportation, we could improve our roads. That would have us have more buses. That would also allow the Bike Coalition to be able to move forward on its agenda. And so you think about, like, how do you bring disparate groups together, and you use this information. Maybe I would want to bring on the schools because it's so important, critically important for kids to be able to access schools quickly, and obviously parents quickly, and transportation to those schools is necessary. And so maybe I would talk about the fact that the economic loss to schools and the contributing failure of kids who are victims of abuse in terms of their education and special education costs, if we all got together, we could move this issue forward. So those are just, again, top of mind ideas. And so let's go to the next slide. And again, in terms of how do you talk about the economics report, these numbers are really big. So I talked about roads, but what are other things that would be helpful in terms of moving your issue forward? What other comparisons might you use? Is it the size of the California budget? Is it the size of, et cetera? What is most impactful to your community? And let's see what the next slide is. So here's all of those questions in order, sort of put together. And I want to go to really turn it now to you. And let's together and separately fill this out. So if you could take the idea that you were thinking about, I was thinking about transportation, and begin to spend a few minutes filling this out, thinking about who's at the table. And maybe this is an issue that you're actually going to move forward on tomorrow, or maybe at the end of today, and you're going to write an email to somebody that you want to get on your issue. So pick your issue, and then think about who's at the table, that partner, that goes in the first box. What is their role? What considerations do you have about that relationship? Just things to think about as you're asking that question. What message do you want to say? And then finally, what data point is a good comparison? So just take a few minutes, and then we'll come together as a group and we'll share out. But before we do that, let me just see if there's any questions that people have. Make sense? Okay, I know in Alameda we are seeing lots of nods and affirmations. And so if folks on the line have any questions, let us know. Otherwise, if you can just take a few minutes and fill out your forms. And the other piece, and I should have said this at the beginning, we've asked everyone to include their name at the form. But what I'd really like to do is be able to collect these afterwards, because again, it's going to help us in terms of our feedback. You can take a photograph of it if you want to take it home with you, and we'll collate all this information and put it together. Thank you. Maybe we could turn this to that. Oh, they can? Okay.
We'll give folks just a few more minutes.
We'll get started in just a few minutes. I know folks in Alameda are very eager to share their thoughts and what their strategy is going forward, and I really hope that folks in Sonoma and online are able to do the same, and will include everyone in the conversation. So please finish up your last messages on this. Thank you. Okay, thank you so much. So we're back, and just wanted to generate a conversation around how we're going to take action and to move forward on a community protective factor, and how we're going to use the economics report to help enhance that message. And so again, you guys know this better than I do now, these six different points, and what I'd love to be able to do is just open it up for conversation and see if anyone would be interested in sharing what their community strategy is and how they're going to drive it forward in terms of the people they're talking about and what their message is. I'll open it up to folks online and at Sonoma first. Otherwise, I know folks in Alameda are very excited to share.
Katie, this is Chris. I just started to look at a public engagement and information campaign. Can you hear me? Yep.
We can hear you.
Can you repeat the last thing you said, Chris?
Just that I started to look at a strategy. I'm not sure I got everything in the right place, but if we did a public